be known about emergency pet care? A lot of owners are uneducated about what to do in an emergency situation. The reason why I'm so familiar with this is because I've worked in the veterinary field for the last 10 years. A lot of owners don't know what to do when an emergency occurs. They panic, they don't know where to go, they don't know what to do. And that's what I want to talk to you about today. I'm going to go over 3 basic emergency situations that we see on a quite regular basis. The first is a buffo-toe toxicity. The second is a urinary obstruction in a feline. And the third is an allergic reaction. The first thing you need to do, above all, is remain calm. Know where your local vet is or emergency clinic is in case any of these emergencies occur. So I'm going to talk to you about a buffo-toad. Buffo-toads are quite common in South Florida. They are indigenous to low-lying swamplands where bodies of water are. They are very rough, rigid around the sides, opposed to frogs that are smooth and very slimy in appearance. Buffo-toads have a toxin gland that lives behind their ears. Basically, it holds a toxin, and if a dog or another animal bites into this toad, it excretes that poison, that toxin, into the animal's bloodstream through their mucous membranes, basically through their mouth, their gums, and their tongue. This toxin goes through their bloodstream and affects 2 main systems. It affects the cardiovascular system and also affects their neurologic systems. This toxin can cause your pet to become neurologic. It can become ataxic, meaning very wobbly, weak when he's walking, kind of walking like you're drunk, tripping over your feet, that kind of thing. The first thing you want to do if you know that your pet got into a toad is get a damp washcloth. Wipe out the roof of their mouth, their gums, their tongue, the best you can without getting bit, because your pet's mouth can become rigid and you don't want to get bit, so be very careful. What you don't want to do is use a hose. If you use a hose to wipe out your pet's mouth, you may actually cause aspiration pneumonia, which is going to cause a whole other problem. Once you've done that, you want to bring your pet into the emergency clinic or your local vet, wherever's open, depending on the time of day. 1 of 2 things are going to happen when you bring your pet in. This toxin can also cause seizures. I forgot to mention that. If you present your animal to the emergency room and your pet is not showing any of these signs, they'll ask you to wait in the waiting room for about 10 to 15 minutes or so. Make sure that everything is okay. If your pet is presented with seizuring, walking like he's drunk, acting neurologic, your pet will be brought into the back. The doctor will assess your pet, and then they may place an IV catheter to go ahead and administer any medications that would be recommended at that point. According to Roberts 2000, most common clinical signs of buffo-toads are the neurologic reactions, like I mentioned. In a recent interview I conducted with Dr. Michael West in October 2013, a graduate from Florida State University 2008, states that the prognosis is highly variable. It depends on how much toxin the pet received, how sensitive the dog is to the toxin, and how long the treatment was before it was initiated. I'm going to go ahead and jump gears a little bit here and talk to you about a disease that generally affects male cats, a urinary tract infection. I know I've had a urinary tract infection in the past, and it's not fun. It's very painful and it can be very irritating. Well, these cats have a disease called feline lower urinary tract disease. We also abbreviate it, calling it FLUTD. It's basically a catch-all phrase, if you would have. Basically, it connects any lower urinary tract disease that your pet can have, such signs such as frequent urination, straining, blood in the urine, inappropriate urination in and out of the litter box. I'm going to go ahead and discuss this condition a little bit further with you folks. Some signs of urinary obstruction with a feline cat going in and out of the litter pan, vocalizing or in and around the litter pan, straining to urinate, any blood in the urine, strong vocalization. You can also have lethargy, extreme lethargy. You can have vomiting. If you suspect that your cat is blocked, unable to urinate, it is extremely important to bring your pet into the emergency clinic or your local vet as soon as possible, because it can become a life and death situation very quickly. Cats will decline when they are blocked due to increasing levels of toxins in their system that are generally expelled through urination that they're not able to do at this point. Especially high potassium, that is electrolyte imbalance. And the high potassium levels can actually cause your cat's heart rate to stop. According to Williams, surgical management of blocked cats has changed over the years, from being the first line of attack to generally being reserved for cases where medical management techniques are no longer achieving their aim. Another common element seen in the emergency field quite frequently are allergic reactions. Allergic reactions can be caused from something as simple as a bee sting, an insect bite, an ant bite, or something even as simple as changing your laundry detergent. Learn laundry detergent, you don't even realize, but your pets will be laying on a blanket or anything like that, and then their skin is touching it, and they can break out with a reaction. Another type of reaction can be medications, such as vaccines. If your pet has vaccines that day and all of a sudden, a few hours later, you're breaking out in hives or swelling all over the body, that can be a sign of an allergic reaction as well. Basically, you see swelling, facial swelling, hives, red on the belly, you'll notice a lot. Excuse me. Most common reactions, like I said, are the insect stings. Your pet will be presented to the emergency room with a really swollen foot and things like that. Vomiting can also occur, fairly common with allergic reactions. Anaphylaxis, causing shock or trembling, trouble breathing, is rare but can also occur. As published in Bonagor's Kirk's Current Veterinary Therapy, Edition 7, the clinical presentation of an animal with anaphylaxis may be variable and will depend on the species involved, the sensitivity of the individual patient, the type, the amount, and the route of the antigen of the exposure. Anaphylaxis signs can cause, you can look for pale gums, heavy breathing, and severe cases collapsing or fainting. According to Culp's 2009, anaphylaxis to animal bite stings poses significant medical risk of vascular or respiratory reactions and vary according to patient's response and nature of the insult. What I've discussed with you today is literally just the tip of the iceberg. There's so many other different emergency situations that occur. Basically, what I can't stress enough is to remain calm, don't panic. Know where to go, have the information before these cases occur. Make sure you know where your vet is, you know where your emergency clinic is, and don't panic. If you panic, your pet will sense that, and then that actually attributes to your pet's care as well. So please, at all times, remain calm. Thank you.